We are going to be discussing treatments for depression, specifically one biological, one psychological, and one alternative treatment. First, we are going to discuss psychological treatments for depression. These involve face-to-face discussions and interactions between a patient with depression and a therapist. One common psychological treatment used is cognitive behavioral therapy, or CBT for short, where clients are guided in order to change maladaptive thought patterns as well as unhealthy behaviors. It is a combination of cognitive and behavioral therapy. Not too long ago, a branch of CBT was introduced which focuses on mindfulness and stress reduction, which is known as mindfulness-based cognitive therapy. There are multiple aims to CBT, however, it comes with its own sets of strengths and limitations, which will be discussed later on. First, I want to discuss the two aims of CBT. The first aim is for clients to be able to address and revise faulty thought patterns and behaviors. According to psychologist Aaron Beck, people with depression tend to have cognitive biases or engage in irrational thinking, which lead to self-deprecation. Patients are guided in something called cognitive restructuring in order to correct thoughts which are associated with feelings of depression. One way to help clients is through validity testing, in which clients are asked to defend their thoughts and beliefs. If they are unable to provide a valid response with evidence, then the nature of their beliefs are challenged. Teaching patients to monitor their thoughts and test them against reality allows them to focus and stray away from faulty thinking. The second aim of CBT is to allow clients to form effective coping mechanism and problem-solving skills, which can be done in two ways. The first technique is where clients are asked to remember a difficult situation and then, with the help from the therapist, they rehearse how to cope with the situation. This is known as cognitive rehearsal, with the hope to develop new schemas surrounding tough situations so that the client is able to respond to them better. The second technique is homework, so that the client can reinforce what they have learned during therapy sessions. Homework will vary and includes things such as practicing techniques for the session or keeping a diary of positive experiences. Psychologists have also discovered that people with depression have a lack of social skill development, especially when it comes to expressing their feelings. So, CBT therapists encourage clients to slowly engage in activities which are socially rewarding, such as concerts, meeting people, and sports, as people with depression stop doing things which they used to as they fear failure or feel that they are not worthy of experiencing joy. One last thing which is important to mention is that CBT helps clients to focus and develop strategies to deal with the stress, which is often done through a form of CBT known as mindfulness-based cognitive therapy. Mindfulness-based cognitive therapy, or MBCT for short, aims to give clients a sense of autonomy over their thoughts and stressors. Buddhist meditation has a heavy influence on mindfulness techniques employed by MBCT therapists. Mindfulness encourages adopting an attitude of openness and acceptance towards present experiences and thoughts. By focusing on one's breathing, the mind empties itself of thoughts and reduces psychological stress. MBCT also provides methods to shift dysfunctional thoughts which potentially lead to problematic thoughts and behaviors by focusing on current perspectives instead of ruminating. MBCT includes elements of CBT and mindfulness-based stress reduction programs in order to keep patients' minds out of a depressive or anxious loop. One study was conducted in order to determine the long-term effects of MBCT. This was done by Segal et al. 2010, in which 84 people were studied in remission for depression. The participants were randomly allocated to one of three conditions, the first being patients who discontinued medication and attended 8 weekly sessions of MBCT, the second, patients continuing medication without MBCT, and the third condition were patients who were switched to a placebo for the medication. The researchers found that MBCT helped prevent reoccurring episodes just as well as medication and much better than the placebo. The psychological treatments which I have discussed have many strengths when it comes to helping patients with depression. One of the main strengths is that it is as effective as taking antidepressants, according to some studies, with the added benefit that patients do not experience side effects. Relapse rates are also much lower for patients undergoing CBT compared to other treatments. One study, Rush et al. 1997, suggests that the reason patients who undergo CBT have a lower relapse rate than those taking medication is because they actually learn how to cope with their depression and thoughts, which can be used in future. Finally, CBT is personal, as patients develop a relationship with their therapist, and so adequate support can be given. According to Benon and Schindler, 1998, the rating of the clients following the initial session is the main indicator of success of the therapy. This could also be seen as a limitation, as it is not the therapy but rather the relationship with the therapist which is more important in the recovery of the client, which brings me to the limitations of CBT. CBT may not be the best option for all clients. For those who require immediate help and patients who are extremely depressed and/or suicidal, CBT may take too long, or the patients may not be in a state in which they can discuss things properly. In these cases, CBT is used once the patient has been stabilized through medication. Another criticism against CBT is that it focuses on symptoms rather than causes. It does not look into a patient's past, and it does not address the biological natures of depression. Finally, the therapist assesses the situation and decides what the best course of action is, and this is known as directive therapy. As a result, there's concern surrounding gender and cultural biases during therapy, which must also be considered.
Biological treatments for depression involve prescribing drugs and/or medicines to individuals in an attempt to restore the chemical balance in their brain. This is because depression is correlated to the idea that there is an imbalance in neurotransmitters such as dopamine, serotonin, and noradrenaline. Therefore, one example of biological treatment for depression is drug therapy. A psychoactive drug that helps treat depression are antidepressants. According to Pratt et al., 2011 and 2010, antidepressants were the second most commonly prescribed medication in the US. The goal of treating chronic depression with antidepressants is to alleviate symptoms. A positive response to drug therapy or drug treatment is when patients show a quite visible improvement and near absence of the symptoms, which is known as remission. Although a patient achieves remission, they are still prone to having a relapse only if medication is discontinued and the symptoms return. These prescribed drugs work by affecting neurotransmitters. Specifically, antidepressants aim to increase or decrease the levels of available neurotransmitters in the synaptic gap. This is known as the monoamine hypothesis, which suggests that depression results from a chemical imbalance in monoamine neurotransmitters like serotonin and dopamine. According to Leo and Lacasse, 2008, the current antidepressants target the level of serotonin, which is believed to play an important role in mood regulation. Additionally, the serotonin hypothesis transformed the treatment of depression, which was done through the essential distinction between correlation and causation. This focus shifted from understanding that depression was a natural response to stress or de-stress. The focus shifted to serotonin deficiency as a potential cause of depression, which allowed the drugs to correct the chemical imbalance in our brains. Drug therapy has some strengths and weaknesses. Starting off with strengths. Drug therapy allows individuals who suffer from depression to alleviate symptoms that make daily living extremely difficult for them. Psychiatrists believe that antidepressants are very effective in doing this, as it seemed to help prevent suicide. According to Geddes et al., who carried out a symptomatic review in 2003, and concluded that antidepressant drugs are an effective way to treat depression and, most importantly, prevent patients relapsing. Moving on to limitations of drug therapy. A problem that arises with the use of antidepressants is a negative side effect of using the drug itself. Common side effects are insomnia, anxiety, nausea, and increased weight gain. These side effects often contribute to low self-esteem, which is a characteristic of chronically depressed patients. Another limitation is patients may become dependent on the prescribed drug. Antidepressants and anti-anxiety drugs can lead to something called discontinuation syndrome, or often known as withdrawal symptoms. If the drugs are discontinued, the chance of a relapse is high. One study made by Holland et al. Compared the discontinuation of antidepressants in 2005. After 16 weeks of treatment, discontinued cognitive behavioral therapy. The researchers found that 76% of patients who received a drug treatment relapsed following medicational withdrawal. However, 31% of patients relapsed were treated with therapy. Lastly, there are also some ethical concerns with drug therapy. A major concern is in the rise in prescriptions of drugs like antidepressants. This is an ethical concern because antidepressants can cause harm if they are not prescribed properly. If the drug treatment is seen as an emergency, for example, if the patient is suicidal or has suicidal thoughts, the drug cannot be given without the consent of the patient, unless if the patient is unable to do so by themselves. This consent involves providing full information about the potential benefits and drawbacks of the desired drug. There is an ongoing debate regarding possible medical and psychological risks in prescribing a large amount of antidepressants, and if the drug is effective in long term, since most clinical trials are only 6 to 8 weeks long and only announce whether patients report a reduction in depressive symptoms.
Moving on to an alternative therapy for depression. Alternative medicine is a term which describes medical treatments that are used instead of traditional or mainstream treatments. One of the most commonly used alternative therapies across the world is acupuncture. There has been some evidence to suggest that acupuncture may help patients with depression. However, as it is an alternative form of treatment, it has many limitations as it is not commonly used compared to traditional forms of treatment such as medication and therapy. First, acupuncture will be discussed. This treatment involves the insertion of extremely thin needles into the skin on very strategic points on the body. Once the person being treated through acupuncture is set up on a padded table, somewhere between 5 and 20 needles are inserted into the skin at various depths. This often gives no to very little aching sensations when the needle hits the correct depth, and some practitioners will apply heat or mild electrical impulses to the needles. After about 10 to 20 minutes, the needles are removed. Acupuncture was originally a form of Chinese medicine which was thought to relieve discomfort, pain, and mental illness. Chinese traditional medicine explains that acupuncture balances the flow of energy through meridians in the body. This technique has been adopted by Western culture in which they believe that the stimulation boosts the body's natural painkillers. Depending on where a person goes to get treated, there is a variation on how it is practiced as many places incorporate Western and Eastern methods. Prior to a person's initial session, the practitioner will examine the patient and ask them a variety of questions about their lifestyle, health, and a physical examination in order to decide the best approach to treatment. Most people will undergo about 6 to 8 sessions.
One study which was conducted in order to test the effectiveness and adverse effects of acupuncture for treatment to individuals with depression was conducted by Smith et al. In 2018. The participants in the study consisted of adult men and women who had been diagnosed with depression, according to the Diagnostic and Statistical Manual of the Mental Health Disorders 4th edition, the Research Diagnostic Criteria, the International Statistical Classification of Diseases and Health-Related Problems, or the Chinese Classification of Mental Disorders 3rd edition revised. In order to conduct their research, researchers collected data from controlled trials which compared acupuncture, no treatment, medication, and structured psychotherapies by collecting the reduction in severity of depression. This was measured through self-rating scales, clinician rating scales, and rates of remission. According to the data collected, there is very little evidence to suggest that acupuncture improved the conditions of depressed patients. Also, there was very little evidence to suggest that acupuncture was better than other treatments of depression such as medication or psychotherapies. The researchers concluded that there is not sufficient evidence to show that acupuncture is an effective method for treating patients with depression. One argued strength of this study is that it uses a very large amount of data which already existed in order for comparisons and conclusions to be drawn without having to spend time waiting for patients to undergo various types of treatment. The strength of this treatment itself is that it often does not cost as much as certain medications and therapies, which helps patients who may not have the needs to be able to pay for most costly treatments. Finally, it can be seen as an alternative form of physical therapy which could be used in conjunction with other treatments. However, the study is also quite limited. There were multiple diagnostic tools which were used to diagnose participants, so the participants may have had different symptoms of the disorder. The participants could also be diagnosed with what each tool considered to be depression, while other tools may classify the disorder as something completely different. It runs a high risk of performance bias, as the data was simply collected from research which had already been conducted, and some participants perhaps were given more attention than others. The effectiveness of this treatment likely varied as well, as different practitioners and therapists will give patients different outcomes. One limitation on acupuncture itself is that there is not much research which has been conducted regarding its effectiveness in treating depression. That'll be all from us today. Thank you so much for watching.